About 27.19 million women above the age of 15 are at risk of cervical cancer. And guess what? Some of these risk factors are preventable. Hi guys, welcome back to my YouTube channel. Today we're talking about cervical cancer, the possible risk factors, and from knowing the risk factors, you could know what to do to prevent this type of cancer for women from occurring in your lifetime. Present statistics right now, about 12,075 women are diagnosed with cervical cancer annually, while for deaths, about 7,968 deaths are recorded yearly. I want to tell you about the risk factors. One of the most prominent causes of cervical cancer is HPV virus, which is the human papilloma virus. And this virus is very rampant. It has about 150 related types of viruses. In this group of viruses, that's the HPV virus. And it manifests as warts. So you commonly know it as warts, genital warts and all of the skin warts. You know, it's a different kinds of warts. So when a human being gets this infection, it's manifested as what? Now, how can another human being that does not have this infection get it? By skin to skin contact and by sexual activity. Women get it at the end of the day when they are getting to from age 26 to 65, they become at risk of getting cervical cancer. You can actually get vaccinated against HPV before you're 26, or when you're young. If one is young and they're already sexually active, they need to get vaccinated against HPV before they are 26. Now, this vaccination keeps you safe and keeps you immune from getting the HPV virus. So I would strongly advise, if you're yet to be vaccinated, you should go to a hospital and get vaccinated against HPV virus, because it is very important. Another thing you should know, that it is also estimated that this death rates of cervical cancer could increase by 63 to 50% in the next year for women lower than the age of 65 and for women older than the age of 65. So you should really get vaccinated or take note of these risk factors that I'm about to mention, so that you are not at risk of this cervical cancer. Some of the places that this warts can surface in is the skin, the anus, the genital area, and the mouth. So you should take note of this, especially if you're sexually active and you are around a sexual partner that is not faithful. You look out for these things, so you're not at risk of getting cervical cancer in the long run due to getting an infection of HPV virus. Now, other risk factors include a weakened immune system. So I would advise that you eat very well to help boost your immune system, and I also advise that you take supplements. Take supplements to boost your immune system so you can be healthy. Sleep well. Try to sleep early, wake up early. It makes you healthy and it makes you strong. Smoking is also a risk factor of cervical cancer. Then sexual history. When we talk about sexual history, you should be, if you have many sexual partners, you're at risk of cervical cancer. If you have more than one sexual partner, you're at risk of cervical cancer. And also, if your sexual partner is at a high probability of having many sexual partners, then you are at risk of cervical cancer. Also, for people who started having sex younger than the age of 18, they are also at risk of having cervical cancer. Make sure you have just one sexual partner, because having multiple sexual partners are associated with a lot of disease conditions. Multiple pregnancies, having your first full-term pregnancy at a very young age, long-term use of oral contraceptives, having a diet that is low in fruits and vegetables. Please eat well. Eating well cannot be overemphasized, so please make sure you eat well. Eat lots of fruits, eat lots of vegetables. It is very necessary for you. A family member that had cervical cancer puts you at a very high risk of having cervical cancer. Coming to the end of this video, I'm going to give you a tip. One thing that helps reduce the risk of cervical cancer is actually using IUD devices. That's intrauterine devices. It usually decreases the risk. Research has shown that it decreases the risk of getting cervical cancer. So it's something you should look into. Anyway, thank you for joining me today. If you're yet to subscribe, please do well to hit the subscribe button and share this video so more people could know how to reduce their risks of having cervical cancer. Let's keep our women safe, let's keep ourselves safe, and let's keep our loved ones safe.